Hi, Miss Yoon. How are you today?
Good. How are you?
I'm doing great. My name is Jessica, and I'm your pharmacist. I see you have a new prescription with us today.
Yes.
Would you mind if I took a few minutes to go over a
Sure.
few things about this with you?
Sure.
All right. This prescription that you're getting today is called Advair. And did your doctor happen to tell you what this is for?
Oh, that's for my asthma.
Yes, that's absolutely correct. What Advair is, it's a combination of two different medications. It's fluticasone and salmeterol. And what those are for, it's going to help with the inflammation in your airways that's caused by asthma. It's going to help open those up so you can breathe easier. And what Advair is for, it's not a rescue inhaler. You're not going to take it when you have an asthma attack, so you'll want to keep your usual rescue inhaler for that. What this is you're going to take this twice a day, in the morning and the evening, usually 12 hours apart, and not any more than that. And you might be worried when I say that about what happens if you miss a dose. If you miss a dose, that's all right. I mean, if you miss a dose, you can just skip it and go on to the next one as you normally would take it. Because the most important thing with that is you don't want to double up the doses because that can cause unwanted effects. And speaking of those unwanted effects, with any drug, you're going to have some side effects. The most common ones with this drug, though, are going to be dry mouth, nausea, vomiting, a little bit of voice hoarseness, just typical things like that. But they shouldn't be too big of a problem, but if they're particularly bothersome or they stick around for a while, you might want to talk to your doctor about that, see if there's anything that can be done with that. There's a few things you might want to keep in mind. Once you start taking this, if you happen to notice a rash or swelling in the face or breaking out in hives anywhere, you're going to want to get care for that really quickly because that's a sign of a severe allergic reaction. Now I'm going to demonstrate to you just how this is used because it's not like a normal medication that you just pop a pill. It comes in a discus like this. The one you will get will be packaged in foil, and once you open that, it's good for 30 days, but there's 60 doses in here, which allows for twice a day. And like I said, if you skip a dose, you might have some left after 30 days, but you're going to want to just go ahead and toss that out. And the way this works is you hold it like this, and you put your thumb right here and open it like this, and it reveals a mouthpiece. And then this little lever right here, you'll push it back until it clicks. What that does is it releases a blister pack of the powder inside here. And that means when you hear that click, it means it's ready for you to take. And what you'll do is you will breathe out completely away from the mouthpiece. You don't ever want to breathe into it. And then you just lift it to your mouth and just take a deep, rapid breath. And then what's important then is that you hold your breath for at least 10 seconds. You don't want to breathe out the medication that you just breathe in, or else it won't work. And then when you're done with that, you just close it back up, like that, and you're done. Then you're going to want to rinse your mouth out with water afterwards, just to avoid the dry mouth and to make sure there's none left in your mouth for you to swallow. Now for storage, you're going to want to keep this in a cool, dry place, such as your bedroom. You're not going to want to keep it in the bathroom or in the kitchen, someplace where it could get water in it, because that would mess up the powder. It would make it stick to the inside and not work. Do you have any questions for me today? Does it sound like, do you think you know, would you be able to demonstrate it for me?
I think so.
All right.
Thank you.
If you have any questions, if there's anything you think of that I wasn't able to cover here today, that you can just call me or stop by the pharmacy or ask your physician.
All right.
All right.
Okay. Thank you.
Thank you. You have a great day.
You too. Bye-bye.